The topic of the tutorial is palate, and I, Dr. Alpana Kesar, will be covering this topic under two main headings: hard palate and soft palate. Hard palate will be covered under the subheads: structural components of hard palate, nerve supply of hard palate, and its blood supply. Soft palate will be covered under the following subheads: muscles of the soft palate, innervation of the soft palate, its blood supply, and lymphatic drainage. Hard palate. This is the palate. The anterior part of the palate is called the hard palate, and the posterior part of the palate is called the soft palate. Hard palate is called so because it is made up of bones covered by mucosa on both its surfaces. Soft palate is called so because it is made up of muscles and aponeurosis covered by mucosa on both its surfaces. Bony palate is covered above by the respiratory mucosa and forms the floor of the nasal cavity. And the hard palate is covered below by the oral mucosa and forms the roof of the oral cavity. Bones forming the hard palate are: anteriorly it is formed by palatine process of maxilla, and posteriorly it is formed by horizontal plates of palatine bone. Boundaries of the hard palate. Hard palate is bounded anteriorly and laterally by the alveolar arch and the teeth. Posteriorly, hard palate is bounded by the soft palate. Features of the mucosa of hard palate. Palatine rugae. These are palatine rugae. Palatine rugae are transverse palatine folds. Palatine raphe. This is the palatine raphe. It is a median longitudinal ridge. Incisive papillae. Here is present incisive papillae. It is a small elevation present just behind the incisor teeth. It overlies incisive fossa. Innervation, blood supply, and lymphatic drainage of hard palate. Nerve supply. The anterior part of the hard palate is supplied by nasopalatine nerves. The posterior part of the hard palate gets its sensory nerve supply from the greater palatine nerves. Both nasopalatine nerves and greater palatine nerves are sensory to the hard palate and are branches of maxillary nerve. Arterial blood supply of the hard palate is by greater palatine artery. Greater palatine artery is a branch of maxillary artery. Venous drainage is in the pterygoid plexus of veins. Lymphatic drainage is in the upper deep cervical group of lymph nodes. Soft palate. This is soft palate. In this visual, this is soft palate. Soft palate is present posterior to the hard palate. It consists of musculoaponeurotic core which is covered by mucosa on both its surfaces. The soft palate is formed and moved by 5 muscles. A small tear-shaped projection hangs from its posterior free margin. It is called uvula. Functions of soft palate. Soft palate acts as a valve present at the junction of nasopharynx and oropharynx. Most of the times, the soft palate stays depressed. When it is depressed, it closes oral cavity from oropharynx. However, it allows a patent respiratory passage where air flows through the nasal cavity into the nasopharynx, oropharynx, larynx, into the trachea. However, at the time of swallowing of food, as in this case, the soft palate gets elevated and it shuts off nasopharynx from the oropharynx. This prevents the bolus of food from entering the nasopharynx and then going into the nasal cavity, thus obstructing the respiratory passage. Hence, at the time of swallowing, the soft palate gets elevated to close nasopharynx from the oropharynx so that the bolus of food can pass down into the laryngopharynx and then into the esophagus. Muscles of the soft palate. In the soft palate are present 5 pairs of muscles, one on each side. They help in the formation and movement of the soft palate. Two of these muscles descend into the palate from the base of the skull, and they are tensor villi palatini and levator villi palatini. Two muscles ascend into the palate from the tongue and pharynx respectively, and they are palatoglossus and palatopharyngeus. Last muscle is associated with uvula and that is called musculus uvulae. Tensor villi palatini. The origin of tensor villi palatini is from the scaphoid fossa of sphenoid bone, from the spine of sphenoid and from the pharyngotympanic tube. The muscle fibers descend till the pterygoid hamulus. On reaching pterygoid hamulus, the muscle fibers will converge to form the tendon of tensor villi palatini. This tendon hooks around the pterygoid hamulus and then it expands to form the palatine aponeurosis. This palatine aponeurosis is attached to the posterior margins of the hard palate. Palatine aponeurosis acts like the skeleton of soft palate as all the rest of the muscles of soft palate are attached to palatine aponeurosis. Nerve supply of tensor villi palatini is nerve to medial pterygoid, which is a branch of main trunk of mandibular nerve. Nerve to medial pterygoid supplies the medial pterygoid muscle and also supplies tensor villi palatini and tensor tympani. The action of tensor villi palatini is it helps to tense the soft palate and also helps to open the pharyngotympanic tube. Levator villi palatini. Levator villi palatini takes origin from the petrous part of the temporal bone and gets inserted on the superior surface of palatine aponeurosis. Its nerve supply is vagus nerve via pharyngeal plexus. Action is it helps in the elevation of soft palate. It is the only levator of the soft palate. Palatopharyngeus muscle. This is palatopharyngeus. It takes origin from the pharyngeal wall and get inserted on the superior surface of soft palate. It helps to depress the soft palate, elevate the pharynx, and move the palatopharyngeal arch towards the midline. The nerve supply of palatopharyngeus is vagus nerve via pharyngeal plexus. Passavant's ridge. This structure is Passavant's ridge, also known as palatopharyngeal sphincter. The upper fibers of palatopharyngeus run circularly in the upper part of pharynx at the junction of nasopharynx with the oropharynx. These circularly running fibers of palatopharyngeus muscle forms a circular ridge called Passavant's ridge. When soft palate elevates, it comes in contact with Passavant's ridge. Thus, Passavant's ridge acts like a sphincter and along with soft palate, it completely shuts off nasopharynx from the oropharynx at the time of swallowing. Palatoglossus. This muscle is palatoglossus. In this visual, this muscle is palatoglossus. Palatoglossus takes origin from the lateral margin of the tongue and get inserted on the inferior surface of the palatine aponeurosis. When the muscle contracts, it will depress the soft palate, elevate the tongue, and move the palatoglossal arch towards the midline. The nerve supply of palatoglossus muscle is vagus nerve via pharyngeal plexus. Musculus uvulae. Origin of musculus uvulae is posterior nasal spine of hard palate. Insertion is in the connective tissue of the uvula. This muscle is musculus uvulae. The action of musculus uvulae is to elevate and retract uvula. It also helps to thicken the central region of soft palate. The nerve supply of musculus uvulae is vagus nerve via pharyngeal plexus. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Innervation of soft palate. Motor nerve supply of soft palate. All the muscles of soft palate are innervated by vagus nerve through the pharyngeal plexus, except for tensor villi palatini, which is innervated by nerve to medial pterygoid. Nerve to medial pterygoid is a branch of main trunk of mandibular nerve. It innervates medial pterygoid muscle, and along with that it also innervates tensor villi palatini and tensor tympani. General sensory innervation. Sensory innervation of soft palate is by lesser palatine nerve. Lesser palatine nerve is a branch of maxillary nerve. Sensory innervation of soft palate is also contributed by glossopharyngeal nerve. Special sensory innervation. Taste sensations from the palate is carried through the lesser palatine nerve. The gustatory fibers then pass into the greater petrosal nerve, then to the facial nerve, and relay into the nucleus of tractus solitarius. The parasympathetic or secretomotor innervation to the glands in the soft palate. The pathway followed by the secretomotor fibers is: it begins in the superior salivatory nucleus, pass into the nervus intermedius and the facial nerve, then into its greater petrosal branch, relay into the pterygopalatine ganglion. The postganglionic fibers arising from the pterygopalatine ganglion are distributed through the palatine branch and finally through the lesser palatine nerve to the glands in the soft palate. Arteries of the soft palate that supply blood to the soft palate are: greater palatine artery, which is a branch of maxillary artery; ascending palatine artery, branch of facial artery; and the palatine branch of ascending pharyngeal artery. The maxillary artery, facial artery, and the ascending pharyngeal artery are all branches of external carotid artery. Veins of the soft palate. Veins of the soft palate follow the same course as the arteries of the soft palate and drain into one of the three veins. 1. Into the pterygoid plexus of veins in the infratemporal fossa. 2. A network of veins associated with palatine tonsil which drain into pharyngeal plexus. Or it may directly drain into the facial vein. Lymphatic drainage of soft palate is into deep cervical group of lymph nodes. Questions asked in the examinations from the topic hard and soft palate are: describe the muscles of soft palate, in which all the five muscles must be described under the following heads: origin, insertion, nerve supply, and action. Yet another question from soft palate can be: innervation, arterial supply, venous drainage, and lymphatic drainage of soft palate. In the exams may be asked: nerve and blood supply of hard palate.